I was introduced to the concept of the designer vagina operation via, I think it was a Channel 4 television programme that talked about it. And the following day I had a lady present and said, look, I've been after this sort of thing for years and didn't know it was possible. Would you mind considering me for the operation? And I did the operation, which is a relatively simple, tiny operation, and she was delighted with the results, over the moon. And since then I've had a steady stream of ladies presenting for it. There tends to be two main reasons why somebody wishes it. One tends to be that they've just literally got an issue with large labia that hang down and they feel very self-conscious, and they often have since puberty, and I think it's a deep-seated issue that goes back to childhood for some. And for others, they actually get functional issues with this extra bit of skin. It can feel uncomfortable. Riding a bicycle can be very difficult. Riding a horse can be very difficult. And sometimes it's uncomfortable during sex as well. So they're the two type of indications for it. The operation itself is a very simple operation. It can be done awake or asleep. I'm always very surprised that some ladies elect to have it done awake because they don't want a general anaesthetic. And in those cases, we'll make sure as far as possible that we've got entirely female theatre staff around during the operation. We tend to use buried dissolvable stitches, so there are no stitches to be pulled out afterwards. It's a difficult area to keep clean and dry after surgery, and so my advice to patients is that they try not to wear pants for the first week, and that they bathe regularly and then use a hairdryer on a low heat setting to waft the area dry to ensure that it stays nice and dry and isn't moist, and that way you get optimum speedy healing. In terms of complications, the commonest two complications are wound infection and the wound opening up a little bit. And if that happens, it's just a question of sitting it out. Don't panic, and it gets better on its own, but it can take occasionally several weeks for that to happen, but that's very uncommon.